Treating asthma with functional medicine. Utilizing functional medicine to treat asthma. The chronic health disease asthma is characterized by airway inflammation. The goal of functional medicine is to correct the fundamental imbalances that cause disease. Asthma sufferers can benefit from it by assisting in the identification and reduction of asthma triggers. For instance, blood testing to look for immunological responses to various diets. Assisting the immune system to reduce its reactivity. Modifying one's diet to reduce the body's inflammation levels. Examining other bodily system abnormalities that may be exacerbating asthma, such as digestive issues or hormone imbalances, may be helpful. Putting into practice lifestyle changes that can aid in the long-term, efficient control of asthma symptoms. These consist of relaxation methods and breathing exercises. In asthma, like any stress, induced inflammation, airway linings swell, and an excessive amount of mucus is generated. Along with this, the airways narrow and constrict. Breathing becomes more challenging because to the constrictions, edema, and more mucus. Shortness of breath, coughing, and wheezing are some of the symptoms that come from this. Although these symptoms are generally present, they are usually only somewhat acute when an asthma attack occurs. When an asthmatic pushes themselves, such as during exercise, the symptoms can also get worse. Asthma comes in two primary varieties. An overactive immune reaction to a common element of our environment sets off allergic asthma. This can include food, cat dander, or pollen. This particular form of asthma generally appears in children and runs in families. Many sufferers also have eczema or hay fever, which are similar allergic diseases. The term non-allergic asthma refers to kinds of asthma brought on by different stimuli. This encompasses asthma brought on by smoking, as well as asthma brought on by pollutants or physical activity. A doctor will often diagnose asthma based on a patient's symptoms and the results of a breath test. The breath tests can gauge a person's lung capacity and look for inflammation is present in the airways. After being given an asthma diagnosis, patients are given an inhaler to assist them control their symptoms. Certain kinds of asthma inhalers include drugs that may aid in clearing the airways during an asthma attack. Others contain steroids that assist in reducing airway inflammation and reducing the body's hyperactive immunological response. The underlying cause of asthma is not addressed by either type of asthma inhaler, although they do treat the symptoms.